We're talking sun this morning as the Dubai weather starts getting really fabulous at this time of year and we start spending more time in the great outdoors. But are you getting too much or too little sun? And do you know what to look for in terms of signs of skin cancer? I'd like to welcome Dr. Juliane Reuter, Dermatologist at Koster Clinic and Dr. Sadir Alrawi, the Director of Surgical Oncology Services at Zahra Hospital. Good morning to you both.
Good morning.
Great to have you in. The sun, of course, it's vitally important. But, you know, there's so much information out there that's often really conflicting. Where I grew up in Australia, you know, we had the message of, you knew this, Dr. Juliane, slip, slop, slap. You slip on a shirt, slap on some sunscreen and slap on some sunscreen and slap on a hat. That was something that every child grew up with, you know, in the last couple of decades. But we need to make sure we're getting optimum levels of vitamin D at the same time as trying to avoid skin cancer, and this is where the dilemma kind of happens. So, Dr. Juliane, how much sun should we be getting? The big question.
Well, we should get sun for our mood to feel better, but we always should avoid the sunburn. The main thing is to avoid the sunburn. Everybody has his own threshold before the skin turns red, so that should not be reached. So in order to be longer in the sun, you should put sunscreen. And the amount of sunscreen, everything should be, all the exposed areas should be covered with sunscreen. It should be a broad spectrum cover. Should be something that is covering the UVB and the UVA radiation. That is very important because the sun protection factor, if it says sun protection factor 30, it only protects from the UVB radiation, which is giving you the sunburn, but it doesn't protect you from the UVA radiation. So you need to find a screen that is covering for UVA specifically as well.
So is that the most important factor then? You know, should we not be, you know, too concerned about the shirts or being covered up as much? Because, you know, I'm thinking, I'm somebody who's covered up, and I'm thinking, actually, I'm pretty well protected from the sun. But Dr. Sadir, you're telling me that that's not quite right.
That's not quite right. The incidence of having skin cancer, it is as the same incidence of having with people who are really covered versus not covered. However, because there's most likely genetic factors that play the major role in having this type of the cancer. However, carcinogenic effect of the ultraviolet light plus other environmental factors can predispose, which is really in coexisting genetic changes that can be presented in the person itself. So people who are really skin covered doesn't mean that they have less incidence than people who are not skin covered.
That's, I think, a really important point that we really need to emphasize today in terms of misconceptions, because there are quite a few misconceptions around the sun and sun exposure. We're actually getting some questions in already from our listeners. This one coming in from Susie saying, would you advise 20 minutes of daily sunshine or a vitamin D supplement? This is one of the big questions. Are supplements enough, or should we be getting out into the sunshine? Dr. Juliane.
Well, vitamin D, as you don't have to supplement it every day, it's easy to supplement it just for a certain amount of time, just for a month or something to stock up the storage. As I say, in the sun is good for the mood. 10 minutes every day is no problem with that, because you won't get a sunburn in this time usually. But supplementation of vitamin D, I would recommend that, yeah. I do recommend this to my patients.
Okay, so this is interesting to me because I've been told that you need to take it consistently every day, vitamin D.
No, vitamin D is stored in the fat tissue. You can use it as a course. You can use it over a period of time, and then you can stop it.
You can use it for a month?
And you can use it for a month, and then you stop it. And then I usually tell people, use it for 2-3 months, twice a year.
Okay. But obviously getting out for a little bit of sun is a good thing. But you should be putting on the sunscreen.
Yeah, but when you put on the sunscreen, as we just have said, it protects you from the UVB radiation, but that is the radiation you need in order to produce the vitamin D. So when you go out in the sun under sunscreen, you will not produce enough vitamin D. So I think it's
a few minutes without that sunscreen is fine.
That should be fine.
Just don't overdo it. Just don't overdo it. But Dr. Sadir, in just before the show, we were having a chat, and you were telling me about all of the amazing benefits, actually, of getting sun exposure. Some that came as a surprise to me personally, and will to our listeners as well. When we come back, we are going to discuss those benefits and much more, and we are going to be giving you another chance to go into the draw for one of the greatest prizes, and that is to experience the wonderful Anatolian restaurant Roya. Plenty coming up on Ion Health. Welcome back. We've got Dr. Juliane Reuter, dermatologist at Koster Clinic, and Dr. Sadir Alrawi, Director of Surgical Oncology Services at Zahra Hospital, and we're talking sun exposure this morning. How much do you need, and what are the benefits? And we're going to launch into that in just a moment, and they are certainly here to take your questions on the sun and skin and everything else in between. So please do send in your questions to 4001 and on the Dubai Eye app, and would also be taking your calls on live on air. Also 423 1010 is the number to get in touch. But this hour, and in fact it's such a great competition, we're going to keep it running throughout the whole show. We are registering people this week for the chance to win a table for 6 people at the fabulous Roya restaurant based in Grosvenor House Hotel at Dubai Marina. This Anatolian restaurant, I mean, can I just say, Joe, you've been there as well. You know for a fact that in fact Turkish food is one of the greatest joys in life, and Roya restaurant does not disappoint.
I know, and I'm slightly disappointed that I can't enter the competition myself, Sally. It's beautiful, it's really light, it's delicious, it's sharing food, it's enter.
Oh, it's yummy. Okay, so if you want to enter, all you've got to do is just answer this very simple question, and Joe, you came up with this one. Muhammara is a cold starter dip served at Roya restaurant. It's made using roasted red peppers, tomato, and what type of nut? And I happen to make some of the best muhammara in the whole wide world, and I'm going to make that for you during next week, Joe, so you'll be tasting that from me.
We're swapping that with mince pies.
Yes. Getting into the festive feel, we've got the Christmas tree here in the studio, mince pies out, and a bit of muhammara to top it all off. If you know the answer to that question, what is the nut that is used in the muhammara dip? Send that in to 4001 or on the Dubai Eye app with your name. We're going to put you into the draw for that registration, today's registration, and it will be drawn on Thursday when Dubai Today is at the Rugby Sevens. So let's get back to the conversation right now, all about sun and sun exposure. Dr. Sadir, you came in today with some fantastic research that has just been published, all about the benefits of sun exposure. Please do take us through, because there are many benefits, even though we are trying to avoid skin cancer, but it's all about the balance. Give us some of the benefits.
So despite that sun exposure can cause, with the ultraviolet light, cause skin cancer, there are a lot of beneficial effects of the sun exposure. This has been proven by one of the recent paper published in 2016 December in the Medical Hypothesis, which is one of the top quality papers, that sunlight contribute to prevention of colon cancer, breast cancer, prostate cancer, non-Hodgkin lymphoma, multiple sclerosis, high blood pressure, and diabetes. The mechanism why this happened is through immune modulation of the immune system and the formation of certain material like nitric oxide, melatonin, and serotonin, which is the mood behavioral improvement, and the effect of sunlight on our biological clock, which we call the circadian clock.
So these are the chemicals that are stimulated through the exposure to sunlight that are all beneficial.
Definitely.
Yeah.
So these are the most important part of exposure to sunlight, but we go back to the same point as we will with the standard, that sun exposure in moderation will will be necessary. However, excessive exposure to sunlight with the ultraviolet can cause different harmful effect. The other important factor, which is any really of the audience would like to hear about it, which is clear being proven from the International Journal of Environment Research with the Public Health that has been published in October 2016. It shows that exposure to the sun in a moderate amount will decrease the risk of obesity or the morbid obesity and increase also cardiometabolic function properly rather than any abnormality in the cardiometabolic function of the body.
This is fascinating. It decreases the likelihood of obesity. And how does that happen? What is the connection between...
The real mechanism is not very clear, but we'll go back to the same immune modulation of the system of the body and secreting of these more helpful material like nitric oxide, going back again, and serotonin, and these other top factors in the body that's been present naturally in the body, but is going to be elaborated in moderate amount when they're exposed to the sun.
So this is moderate amounts of exposure to the sun. This is the point that we really have to emphasize, Dr. Juliane, that it is about finding that balance. And you were saying earlier that there isn't a particular set time for everybody. Everybody is different. How do you work it out?
Well, you don't work it out. You put the sunscreen and you
just
go
get
in the
out
sun
there.
and you get out the protector because you don't know. You might know, but it's usually 10 to 30 minutes, and you rather put the sunscreen in order to not try the sunburn or know when you...
And right now the weather is so beautiful in Dubai. You know, we're so lucky. Our winters are gorgeous here in this part of the world. But, you know, sometimes we think the summer sun is a lot stronger than the winter sun. The winter sun is fine. You know, we don't really need to put on sunscreen. The weather is cooler.
It's not like that. Of course, you have to put sunscreen in the winter sun as well. So it's not like there's a big difference in the damage of the sun.
We can get lazy though. Do you find that? Do you find that you know, some of your patients may get lazier in the winter and not to do it as much?
Well, maybe because they don't get sunburned, but no, it's like the sun is the same like in the summer. You should always be protected. We might get lazy a little bit because the sun is shining every day here, so we would need to put sunscreen every single day. But it's really it's necessary. That's just the way it is here in Dubai.
And in terms of I believe there's a special way of putting on sunscreen, like you've got to put it on 20 minutes before you go out
that
into the
counts
sun.
for the chemical filters. When you put a physical filter, there's different types of sunscreens. The one with the chemical filters, they need a little bit of time before they work in the sun. That's why we say you put it on half an hour before you go in the sun. And the physical filters you can put on and they reflect the sun right away. So they help you right away when you put them on.
Okay, so there are different types of sunscreen.
Different types of sunscreen.
Okay,
yeah.
And how will you know that when you pick up the sunscreen?
Well, it says on the. It says actually on the.
Follow the instructions.
Follow the instructions. It says chemical-free filter if you don't have any chemicals, and then there are only the physical filters, which is the titanium dioxide or the zinc oxide. These are the two physical filters that reflect the sun right away. So if you find that in your sunscreen, then you can go into the sun right away after you put it on the skin.
Okay. All right. We are talking sun exposure this morning with Dr. Juliane Reuter, dermatologist at Koster Clinic, and Dr. Sadir Alrawi, Director of Surgical Oncology Services at Zahra Hospital. And there is so much to talk about in this topic this morning. Dr. Sadir, we want to know now, we want to move on to detecting skin cancer and what are we looking for in terms of when we get too much sun exposure, how much is too much, you know, and how is the skin regenerating itself, and what are the signs that we should be looking for in terms of spotting skin cancer?
I think the question of the skin screening, I will refer to Dr. Juliane for that. But for the aftermath effect, I will answer that part.
Yes, go ahead, please, Dr. Juliane. Yeah.
Well,
in terms of screening, looking at what are we looking for on the skin?
Well, to talk very general, we look for changes, anything that somehow changes in color, size or shape, because there's different types of skin cancers. We have the melanoma, that is usually a colored tumor, and we have the basal cell carcinoma and the squamous cell carcinoma, which is like can have all sorts of appearances, like scaly nodules, reddish, shiny papules. So this is eventually it is all about changing skin lesions, something that looks different than before, something that has somehow changed in in shape, color, or size on the skin.
And how often should we be looking at the skin to check for those changes?
Well, it is recommended to do it monthly. I don't think it's necessary. I think it's fine if you do it between 4 to 6 months. Something like that should be fine if you check yourself regularly. Yeah, in that time frame.
And what's interesting when I was doing the research for the show is I found that there are apps out there that claim to spot skin cancer and skin cancer changes, and some people say that actually it helped them to do that. What do you think about this kind of thing in terms of using an app to look at your skin and to monitor those changes?
Well, I don't think that an app can spot the changes, because a change is something dynamic that you will see yourself. The app can only look at the lesion itself and then give its opinion, and I think that's very dangerous, because I had a lot of patients who come quite scared into my practice saying or thinking they have skin cancer, and eventually turned out that this was totally benign. There was nothing even suspicious about that skin lesion. So I personally don't think these apps are really helpful.
So it's really about just making sure you check it yourself. What about in terms of when we're talking about mole mapping? What's that?
Well, mole mapping means that you take a microscopically enlarged picture of a suspicious lesion, monitor this in the sense of you store it in a database, and when the patient comes back a couple of months later, you can spot the slightest change on a microscopic level in these moles, and this means they show activity, and if they show activity, then that's the moment when you remove that mole.
Is that necessary for people generally to do, or who needs
it's
this?
It's not generally. I mean, skin screening, a skin check is something that everybody should do. The mole mapping is only for lesions that are somehow suspicious. You don't want to remove everything preventionally on the body that somehow looks suspicious. So you map these moles that look suspicious, and then determine how suspicious they are some month later, or half a year later, or whenever the people come back then.
Yeah, and Dr. Sadir, in terms of the skin becoming sunburnt, or going out into the sun and having that tan, the skin does regenerate, but there are times when it's just gone too far. You've just had too much exposure.
Yeah, the natural ability of the skin is to really rebuild itself after a certain period of time and to regenerate without having any damaging effect. However, if it reaches a point that DNA damage or destruction completely, it will peel off by itself, and then a burn will happen beneath it. The most important part, the effect of the ultraviolet on any skin, is how long is this damaging and whether they will give a scarring effect or not. We'll go back to the same question that she had before. Usually when I receive a lesion from a dermatologist, it's usually most likely is diagnosed as the type of the skin cancer is either melanoma, as you said, basal cell carcinoma, or squamous cell carcinoma, and rare entity we call it a Merkel cell tumor. However, certain type of sarcomas like dermatofibrosarcoma of the skin are available, but are less than the other type of malignant type of sarcoma. Usually the tissue diagnosis come to me by the dermatologist. For me as a surgeon, we try to put it into multidisciplinary conference team in order to get the best approach. That's what we had established in our Zahra Cancer Center. Multidisciplinary cancer team is not my decision only. It is going to be the presence of the pathologist, the dermatologist, and the surgeon, plus the radiation oncologist and the medical oncologist, to make a single decision about the best and optimum treatment for that type of cancer. Whether we'll give chemo to start with or give surgery, followed by most of the melanomas. We need, in addition to the surgical resection with a safe margin, we need sentinel lymph node, which is the guarding lymph node in the nearby basin of the lymphatic channel that draining to that part. And that is the standard of care in the United States, standard of care all over the world, and should be done as on regular basis. So by this way, we will give the patient the best and optimum treatment for that.
So you've got a whole team working
Definitely.
on this. I mean, I was imagining it was just one doctor who was looking at it and making a decision as to what the treatment would be, and so on and so forth.
We have a multidisciplinary conference once weekly every single case that come to our center, it has to be discussed.
Wow.
And then documented, and copy of it will be sent to the DHA, Dubai Health Authority, for CME crediting plus verification of our plan and protocol. So the patient, if it goes somewhere else and have different strategy of protocol, they have to communicate with us why our discussion like this, and multiple patient goes for second opinion, either Europe, and we managed to open the second opinion in our center, which is anyone have any cancer or skin cancer can call us and we can give him a free second opinion in our center.
A free second opinion.
A free second opinion
from you.
From our
From your
center, Al
center,
Zahra
from your
Cancer
team.
Center, Dubai.
Okay, that's really interesting. I mean, if somebody needs to get a second opinion, we've seen in the headlines, we've seen people, celebrities, in fact, some like Hugh Jackman, who recently he's had episodes of skin cancer where on his nose 4 times he's had it removed, in fact. So this is another question then, in terms of those who do get skin cancer, is it something that is recurring? Is that a normal thing to see it recurring?
So the cancer of the nose or the face, these are special entities. We need to do them, first of all, we need a Mohs surgery in order to decrease amount of the tissue loss when we take it out. Nobody will like to take 1 to 2 centimeter of skin of the margin of a skin cancer in the head and neck area. So we will take by millimeter, and we send it for frozen section evaluation until come to me is negative. And by this time, when we get negative, we will start to reconstruct of that part. The reconstruction, we have a group of microvascular plastic team. They work with us in order to do either rotation flaps or free flaps to cover that defect, because it should be minimized defect rather than big defect. Now, going back, having recurrence in the same area within a short period of time, that's called recurrence. Having appeared after 1 or 2 years in the same area, that's not a recurrence. That is a second tumor in an area that's exposed to the same damaging effect.
So it depends on the period of time
Definitely.
between the lesions that show up.
Definitely.
I'm just interested in you saying that you take it out millimeter by millimeter.
Definitely. That's the principle of Mohs surgery, which should be standard of care in any of the skin cancers in delicate parts.
Wow. It's that would be a very slow process.
It might take 5. We have one case we did in Tawam. It take us 7 to 8 hours for angiosarcoma of the scalp. And we did it with about more than 40 frozen section evaluation.
That is, that's how you get diligent, detailed
Definitely.
treatment. So it's very good, but I just didn't realize it took so long.
In addition to that, we have the mapping pictures. Picture every specimen we take a picture plus the specimen where we take it, and we really map it completely. We send it to pathology, and the team goes themselves, read it with the dermatopathologist to evaluate if there is a possibility of residual or no residual.
We are talking sun and skin health this morning. And messages coming through. This one from Bridget saying, I had the golden approach, a procedure to remove BCC from my right eye lower lid. It was 6 by 7 millimeters, removed this way by a tumor specialist, and then an eye plastic surgeon sewed it up, and now you can't see it at all. Are these the kind of results that you would be expecting? That, it's very delicate, but it should be done very well.
That is really true. This is a combined procedure by the specialist, cancer specialist, plus the plastic surgeon, because any abnormality in the resection of that area will cause dropping of the lower lid and will be very clearly exposed. Definitely, he will have rotation or advancement flap in order to protect the lower lid from keep opening, and that will cause the eye to have exposure and dryness. So that is the optimum procedure, combined surgery, best result for both the patients and also the result for the doctor.
What are the most common treatments that are being used to treat skin cancers, doctor?
Resection.
Yeah.
The most common is resection with safe margin. Safe margin depend on the type of the cancer. For melanoma, especially thin melanoma, we need 1 centimeter. Intermediate melanoma, we need 2 centimeter margin, and that's the average. But for the squamous cell cancer is more aggressive. than the basal. We need at least 5 millimeter in the head and neck area, 1 centimeter in the biggest area. For the basal cell carcinoma, 1 to 2 millimeter might be enough with the complex or simple closure, and that is the best thing. For the melanoma, we still need the sentinel lymph node. For the Merkel cell, which is a rare type of tumor, which is very aggressive, this is we need at least 1 to 2 centimeter with the sentinel lymph node.
Dr. Juliane, in terms of spotting skin cancer, particularly when you're talking about darker skin tones and skin colors, I mean, are they less likely to get skin cancer? And but then would that make it harder to spot?
No, they are less likely to get skin cancer, but they can still get it. You might know that Bob Marley died of a melanoma, so you can get it on dark skin as well, although they rather get it on palms and soles than on the body.
Is that more likely?
They get it on the body as well, so it's indeed it is spotted later because you cannot see it in the beginning. So when you find them on this type of skin, it's usually in a late stage.
It can be more deadly for that reason. Yeah, so of course, as we were saying throughout the show, it really is about just watching the skin and looking for those signs of change. Yeah, you're looking for those signs of change. Interestingly, looking up different facts about sun and skin damage, tanning beds, you know, people think, oh, you know, it's not as bad as going out into the sun. How bad are tanning beds?
Well, really bad, because this is a specific type of UV radiation. It's the UVA radiation that doesn't give you the sunburn right away, but it penetrates deeper into the skin, and it does damage in the long run. Definitely,
it's worse damage than the sun.
It's worth damaging. It's definitely worse than that. Yeah, definitely. And it's nowadays classified in the same category of to be a carcinogen, just like alcohol, asbestos, and nicotine. So it's really bad. This type of sunbed is banned for minors even in Australia because it's really a 70 times higher melanoma risk if you had a sunbed use in younger years.
70 times higher. 70 times higher risk of developing melanoma skin cancer.
If you had a regular use in youth.
That's really, that's astounding, really, when you think about it. But, you know, one of the things, we love going out into the sun and because we love to enjoy that feeling of being in the sun and
so
getting
we should.
the glowing skin. But at the same time, and this is something that I think we should touch on before we go, how do we keep our skin in the best health as well at the same time? You know, what kind of, I mean, particularly in the face that is mostly exposed to the sun, what should we be doing in terms of, I don't know, skin routines and things like that to keep it looking its optimum? And we all, you know, hate the wrinkles and the age spots and all of that kind of thing. How do we keep all of that away?
Well, we can't keep it away from us, but we can procrastinate a little bit to get the wrinkles by, cleaning our skin properly, using sunscreen in the morning, especially in the face for the anti-wrinkle purpose. It's not only for the anti-sunburns, for the anti-wrinkle purpose. And then there are some ingredients that you can find in creams that are said to enhance the glow in the face, giving you some beauty aspects for the face, like the vitamin C products. They are very good for the facial skincare, for the daily skincare.
Vitamin C creams.
Vitamin C creams, for example, yeah.
You can get cream with vitamin C in it, and that will give your skin that glow.
It's just one. It's just one out of many. There's many different things on the market that you can use.
Dr. Sadir, something that parents think about as a lot, particularly with the whole slip, slop, slap message. When their kids go out into the sun to swim, whatever, there's that trend now of, even for women, the covered the covered swimsuits that covered the arms, covered the legs, supposedly giving more protection. Are these really protecting us from the sun damage or not?
The statistic and the data that clearly suggests that wearing the burkini, which is the Islamic swimsuit, is not less than having incidence of skin cancer than wearing a bikini in a non-Islamic swimsuit. So there is no data to support that wearing more clothes in sun exposure part will happen to decrease your skin cancer incidence. However, general protection, the time exposure will be less, and the time will be affecting on the skin will be less. So genetic will go back to the genetic, and the damaging effect of the environment is the main point in causing the skin cancer.
Should you be wearing sunscreen under your covered swimsuit?
No, should not.
No.
Should not at this time. But however, the tradition is to go. This is, I think, this question will go to Dr. Juliane, if that is from that her part to answer that question.
Mm-hmm. What do you think about that? You know,
Well, if you wear UV clothing, you clearly don't need to use any sunscreen underneath. But if you wear a white T-shirt, for example, there's still 20% of the UV rays that are penetrating the white color. So yeah, then you definitely should wear sunscreen underneath the shirt. When you go with a white shirt into the water, it's more than 50% of the UV rays that are coming on the skin. So you might want to combine it in the normal clothes. But there's UV protection clothes for the kids, then they don't need to wear anything underneath the clothes, then no extra sunscreen underneath.
And in terms of final tips that you would like to give everybody as they get out and enjoy the sun, what would that be, Dr. Sadir?
Get exposure to the sun in a moderate amount. Enjoy your life with activities, and don't get overdoing it, like not the same thing like alcohol or smoking, but keep an eye on your skin, and keep an eye on everything that changes in any mole or any other skin lesions. Visit your dermatologist if you have any concern, and get us a second opinion for us free at any time you want.
Dr. Juliane, do you have anything to add?
No,
for that?
That is all fine.
I think you summed it up very well. Thank you so much to the both of you, Dr. Juliane Reuter, dermatologist at Koster Clinic, and Dr. Sadir Alrawi, Director of Surgical Oncology Services at Zahra Hospital. Thank you for being with us this afternoon.
Thank you.
Most welcome.